Dr. Rachna Sharma, and I'll be presenting today on 3 topics: PatraPottali, Valukasweda, and ShashtikaPindaSweda. We'll start with ShashtikaPindaSweda. Shashtika is a variety of rice which ripens in 60 days. As the name suggests, Shashti. Shashti means 60. So, ShashtikaPindaSweda. The word pin means bolus. PindaSweda refers to the sedation performed by bolus of drugs. ShashtikaPindaSweda is performed in ekam, that means on the affected part of the body, or sarvam, that means on the whole body, with the bolus of boiled Shashtikashali. Shashtikashali is a variety of rice, with balamul quat. Balamul quat is decoction of bala's root. Bala is a plant, decoction of bala's root. And sheet. Sheet means milk. The main properties of Shashtika are snigdh, that means it provides softness to the skin. Sthir, it provides strength and stability. Sheath, it provides soothing effect. And tridosh ghan, that means it pacifies 3 dosh, vat, pitta and kapha. It has brihman gun. Brihman means it provides strength to the body. What are the indications where Shashtikashali is indicated? It is indicated in osteoarthritis, joint pains, cervical pains, low back ache, sciatica, muscular dystrophy, paralysis and cerebral palsy. What are the contraindications? What are the diseases or disorders where we will not be using ShashtikaPindaSweda? DVT, deep vein thrombosis, fractures, fever, cellulitis, severe inflammation and hypertension. What are the requirements for the procedure? ShashtikaPindaSweda. Here I have shown the picture of ShashtikaPindaSweda, which is a variety of rice that we will be taking 500 gram. Balamul quat we will be taking decoction. We will make decoction afterwards. Balamul we will take 750 gram water as per requirement. Cow's milk 3 liter. Cotton cloth 45 by 45 centimeter. We will take 4 pieces of that. Threads to tie the bolus. Vessels for preparing a decoction, for cooking rice, and to heat the boluses and mixture of quat, that means decoction, and milk during the procedure. 5 liters capacity with a white mouth made of bronze. This is the vessel. We will be taking 5 liters capacity vessel. A plate for carrying heated potli, a stove, suitable oil for abhyang, that is 100 milliliter, coconut leaves, tissue paper or towel, therapist and attendant. So first we will make the potli. How it is made? Preparation of the medicine. We will first make balamul quat. We will take 750 gram of balamul, that is cleaned, crushed and boiled in 12 liters of water, which then is reduced to 3 liter. We will take 12 liters of water, 750 gram of balamul and reduce it to 3 liters.
What's the balamul?
Balamul is root of the plant bala. ShashtikaPindaSweda rice cooking. Now we had decoction of 3 liters. We'll part this 1.5 liter separately and separate the 1.5 liter alag se. In 1.5 liter of balamut kashay, that means quat or decoction, and 1.5 liter of milk. We have separated 1.5 liter of decoction. We'll add 1.5 liter of milk in that, and then we'll add the Shashtika rice in that, and then boil till it becomes thick and semi-solid. That you will get to know when you will see it in practical, how much consistency we will be requiring. Sufficient quantity of hot water can be used for proper cooking of the rice. Another method is that Shashtika rice can be semi-cooked in pure water, and then we can add gradually milk and quat and we can cook it again to get a semi-solid type of mixture. Preparation of the boluses. The cooked rice should be divided into 4 equal parts and put into 4 pieces of cotton cloth. As we can see in picture, that is the Shashtika rice. The second one, we took 4 cotton cloth and placed Shashtika Shali rice on them. The 3 corners should be folded neatly together so as to come under the 4th corner, and the 4th fold is used to cover the 3 corners of the fold underneath. Now we have to make bolus, that means potli. We'll take the 4 ends, tie them together, take a cotton thread. Okay? One end of the thread is held tight with the left hand, other end is wound around the folds. In short, the boluses should be tied in such a way that the mouth of the sac leaves a tuft at the top of the bundle for holding it with ease. In third picture, we can see the tuft of the from where we handle. We have to tie that firmly so that it doesn't spread during the procedure. Pre-operative procedures. The patient should be seated with leg extended over the massage table. Abhyang, that is massage, should be then performed with prescribed oil for 10 minutes. So this is pre-procedure. We have to do massage over the area we are going to do Shashtika Shali. Out of 4 potlis, 2 are kept in the mixture of Vala Mool Quat, decoction and milk. Now 1.5, we had 3 liters of Vala Mool Quat. We added 1.5 liter in one part. Other 1.5 we'll keep for potli purposes. We'll dip in that and then we'll use it for the procedure purpose. So that is, out of 4 potlis, 2 are kept in that mixture, Vala Mool Quat and milk, which should be put on the stove for the moderate heat. Procedure. 2 home potlis should be gently applied in a synchronized manner by the 2 therapists on the 2 sides of the massage table. As you can see in the picture, we'll take the potli out of the Vala Mool Quat and milk, and then we'll apply in a synchronized manner by the 2 therapists each on the side of the table. It is followed by a gentle massage with the other hand. They should ensure that the heat of the boluses is bearable to the patient by touching them over the dorsum of their hand. In 3 of the procedures which I will be explaining, in all of them we have to check the temperature to apply before applying it on the patient. With checking it on the dorsum of the hand, we'll check the temperature. If it's bearable to us, then it will be bearable to the patient. The temperature of the boluses should be maintained throughout the procedure by continuous relay of the 4 boluses after reheating by dipping in milk decoction mixture. Once the temperature is reduced of the potli, then we'll take another one. Total we have 4. We'll be changing during the procedure. The process should be continued until the contents of the boluses are exhausted. At the end of the procedure, the potlis are untied, the material is taken out and is gently rubbed over the body for 10 minutes. Now what we'll do after the potlis gets exhausted, we'll take out the rice and gently rub it over the patient's body or the affected organ part of the body. Medicine remained over the body should be wiped with coconut leaf, dry with a tissue paper or soft towels. The patient should take complete rest for at least half an hour, and then patient is allowed to take warm water bath. Duration of the procedure is 45 minutes. What are the precautions? During the preparation of the rice, care should be taken to avoid over or undercooking and should be stirred frequently for better extraction and cooking. Tie bolus firmly to avoid leaking of the contents during rubbing. The therapist in both the sides of the patient should massage with boluses in a synchronized manner. They should go in sync. Ensure uniformity of the pressure and temperature on all the body parts. Boluses should be applied with sufficient warmth. They shouldn't be cold, they shouldn't be overheated. The therapy should be stopped at any time if the patient gets a good perspiration or shivering. What are the complications and what are their management? Shivering, it usually occurs due to uneven distribution of temperature or prolonged time gap in between taking of new boluses, or if the body is exposed to cold breeze immediately after the procedure. Allow the patient to take rest, cover with a blanket and wear warm liquid tide. Now we have to take care that patient, our potlis or the boluses shouldn't be very cold. Fainting due to increased body temperature or low heat threshold of the patient The patient could faint if there is increase in the body temperature. So we should always check the temperature of the patient's temperature. If he or she is having fever, we will not continue with the procedure. Sprinkle cold water over the face and body and put talam with appropriate medicated oil and churan. Talam is a procedure. We take churan along with the oil and put it here on the top of the head. Skin burns or rashes. If any skin burn or rashes, then apply Shatdot grit.
What is Shatdot grit?
Shatdot grit is cow's grit, which is cleaned or churned 100 times. Shat means 100, Dot means clean times. It's pure cow's milk.
Cow's milk.
So cow's ghee.
How can you maintain the temperature of bolus when the rice is being cooked at the same time? The same rice?
No. We cooked the rice, we made the potlis.
Yes.
Okay? 1.5 of balamul and 1.5 liter of milk. We'll keep it separately. We'll heat the milk, put potlis in them.
Okay.
Then we'll be taking potlis and applying on the body. 2 potlis would be placed there and 2 with the therapist. And subsequently we'll change them.
Okay, so you use it, then you put it back, use the other one.
Yeah, other one, yeah. And side by side we'll be heating that mixture.
Sorry, how we are using milk for the potli? I didn't get it.
What? Sorry?
Milk. Okay, to prepare the rice we are using milk.
We'll take balamul kwat and milk.
Okay.
3 liter of balamul kwat we made. We'll separate them. 1.5 we'll use it to cook rice. And add 1.5 liter of milk. Okay, we cook the rice and other 1.5 we'll take, keep during the procedure, we use during the procedure for dipping the potlis. 1.5 of balamul kwat and 1.5 liter of milk.
Okay, got it.
Yes.
I have a question. So, you said that we keep doing it, so we need to wait for decoction to get over or the potli rice to be exhausted.
Sorry, I didn't know.
When to stop? Nothing, the decoction is 1.5 liter.
Yes.
So we need to wait for it to get over. Like we keep pouring, right? And then it will get over at a point or what? Like how do we stop?
45 minutes procedure. After 40 minutes or 35 minutes we'll stop. Then we'll open the potlis, take out the rice and gently rub over the patient's body for 10 minutes.
Thank you.
What all situations we use this?
Osteoarthritis, joint pain, cervical pains, muscular dystrophy, cerebral palsy, as it strengthens the body.
Okay, these are the benefits.
Yeah, exactly. These are the indications in which we use. So next is PatraPottali. Patra means leaves, Potli means bolus, and Sweden means we will be providing sedation by PatraPottali. Introduction. The PatraPottali Sweden is a type of pink Sweden or the Ushna Sweden and produce sweating which enables the harmful toxins to move out of the body. It is widely used in various musculoskeletal diseases. The word PatraPottali suggests that there is involvement of Patra means leaves and Potli means bundle or bolus. In PatraPottali Sweda, the sedation is performed by specially prepared bundle of medicinal leaves accompanied with the base of tail. What are the indication in which disorders we use? Pain around cervical region, backache, sciatica, joint pains, pain in particular part of body, pain in flanks. What are the contraindications in which disorders we do not use this therapy? Subject accustomed to intake of alcohol, patient is under the influence of alcohol at that time, pregnant women, diarrhea, hypertension, dehydrated, injured or weak. What are the requirements? Ingredients. Nirgundi Patra. These are the leaves of the plants like Nirgundi, Erand Patra, leaves of Erand. Ark Patra, we saw them yesterday. Shigru Patra, til tel, sesame oil, haldi powder 10 gram, shatava powder, that is peppermint fennel seeds powder 50 gram, ajwain, that is carom seed powder, will take that 50 gram, garlic 20 cloves, center salt 5 to 10 grams. What are the equipments? A big pan for frying the leaves, a spoon for stirring, knife for chopping the leaves, a tray, heating apparatus for heating the contents, cotton cloth cut in square pieces 12 by 12 inches, and a cotton thread. You can see in picture a big pan, leaves being put into the square pieces of cotton cloth. What are the requirements for the procedure? A massage table on which we will be doing the therapy, and 2 therapists. Preparation of the potli. Take fresh leaves, wash and dry. Chop the leaves and collect in the pan. Keep the big frying pan on a moderate flame. After heating the til in pan, the leaves, ajwain powder, shatava powder, haldi powder, crushed garlic should be mixed together. We take the fresh leaves, we wash them, dry them, and then we chop them. Then we take a big frying pan, pour til around 100 ml. We heat it on a moderate flame. After that, we add all the ingredients. First we'll add ajwain powder. First we'll add leaves. Then after that, ajwain powder, shatava powder, haldi powder, crushed garlic. They should be mixed together, as we can see in the picture. The color of the leaves start changing to brownish color. These bright leaves are placed on the cloth. The free corners of the cloth are approximated to cover the leaves. The free ends of the cloth are folded in its middle. Then it is tied with a cotton thread to make a rounded pack with handle. In this way, potlis are prepared. Now we prepare potlis. After the mixture, when the leaves start changing their color to brownish, we'll turn off the stove. We'll place the mixture over the cotton cloth in the middle. Then we'll approximate and join the 4 corners and tie it with a cotton bandage so that we make a potli. Heating the potli. Now in Shashtika Shali we use balamul cloth and milk for heating the potli. Here what we will do, in a vessel of round bottom, 200 ml of oil is taken and then is heated. The potli prepared are placed on the oil. The potli should be continuously moved, stirring the oil. When the pack is properly heated, it is taken out of the vessel. Any oil flowing from the pack is wiped out of the vessel. We make the potlis. Now we take a different pan or a round shaped vessel. We will pour 200 ml of oil in that. We will heat that oil. Now for heating the potlis, we will place our potlis there, but we will not leave it as it is. We will stir it because otherwise they will be overheated. We stir. Once we check the temperature with the dorsum of the hand, we get the optimum temperature. Then we wipe off the extra oil from the sides of the vessel.
Which oil is used here?
Any oil can be used: sesame oil, dhanvantram oil, vishkarp oil, mahavishkarp oil, mahanarayan oil. Usually we use it for the pain management. All the oils that are used for the pain management, we can use it here. And if we are having no oil, then we can use sesame oil.
Okay, so we are removing oil from the potli.
Sorry?
You have to squeeze the oil.
Squeeze the potli.
Squeeze all of the potli with the corners of the vessel. There will be enough oil to get over the patient's body, but we don't want extra oil dripping from the potli.
Right.
Preparation of the patient. Depending on the comfort of the patient, therapy is performed in sitting position or lying down position. Example, if knee joint is selected and can be performed in a supine position of the patient with head rested upon a pillow and hands placed on the side of the body where knee is exposed. Pradhankaram, what is the main procedure? The heated oil is smeared on the knee joint. Abhyang massage is done on the knee joint, moving the palms in a circular fashion, as you might be told in joints. The temperature of the potli should be confirmed by the therapist by touching the pack on the dorsum of the hand, as we did in Shashtika Shali. The potli is applied on the patient for the Sweden. Then the potli is moved in a circular portion on the joint. What we do, we check the temperature with the dorsum of the hand. We'll pat the potli over the affected organ. Once temperature is reduced thoda sa slightly, not very much, then we gently rub that potli over the patient's body. In practical, you will see how it is done. First we'll pat. First we'll check the temperature over the dorsum of the hand, then we'll pat it, and then we'll gently rub it over the body. That it should be tolerable with the patient's body.
In linear fashion we'll do it. Rubbing.
In joints, circular fashion, and in other limbs we can do in linear. This method is continued till the heat in the part is lost considerably. Then Swedna is continued by taking another potli which is kept in the vessel for heating in a similar manner. Duration of the procedure is 30 to 45 minutes. Paschat Karam, what is the post procedure? Patient is asked to take rest for 15 minutes. The part treated with PatraPottali is washed with the warm water. The patient is advised to take hot water bath after half an hour depending on the disease or till the normal temperature of the body is attained. Management: in case of burns, application of Shadda or grit to the burnt area should be done. Leaking pottery should be immediately replaced with the new ones. What are the do's and the don'ts during the procedure or after the procedure? Patient can consume food after the procedure. Ushna Jalpan, that is the patient can take warm water. Ushna Vihar, that means patient can travel to warm climate or the warm places. Ratri Swapna, that means the patient should go early to bed. What are the don'ts? Sheet Asana, that is cold water bath. Sheet Vihara, exposure to cold. And Diva Swapna, day sleep. Usually what patients do, they take the therapy here in the warm environment, we switch off the fans and everything, and then they go to home in car and they switch on the AC and everything. The patient should be told that you are not advised to take direct air exposure. If you have to use AC, you can like in extreme hot conditions, you can use it after 2 hours.
They shouldn't sleep in daytime.
They shouldn't sleep in daytime, that increases cough. And Ratri Jagran, that means staying up late at night, it increases Vata in the body. So Vata is the main cause for pain, and we are giving therapy to pacify Vata.
Okay, late night sleeping is what?
Yes, it increases Vata in the body.
So the airflow should not be direct, it could be indirect.
In very hot conditions, it's not possible. It should be indirect, like sit in the AC room but not directly under the AC, sit directly in front of cooler.
Past 15 minutes.
For 2 hours.
2 hours.
2 hours. What are the precautions? During the preparation of the leaves, care should be taken to avoid under or overcooking and should be stirred frequently for better extraction and cooking. Tie bolus firmly to avoid leaking of the contents during rubbing. If the patient is suffering from sensory loss or neuropathy, then extra care should be taken regarding the temperature to avoid burns. So if the patient is suffering from sensory loss or there is any neuropathy, say diabetic neuropathy, the patient will not be able to tell the exact temperature to that part of the body. Suppose hands, according to the patient, the temperature is not that much. He will say that it's not very hot, but you will check with the dorsum of the hand, and it will be your decision at that time, because otherwise the patient could get burns. The therapist in both the sides of the patient should massage with the bolus in a similar manner, that is in a synchronized manner. Ensure uniformity of the pressure and temperature on all the body parts. Your potli shouldn't be overheated, or it should also not be very cold. Boluses should be applied with sufficient warmth, that is 45 degree to 50 degree Celsius. The therapy should be stopped at any time if the patient gets good perspiration. Therapists should be very cautious during the procedure, as this procedure may cause severe injury or burns to the skin. Thank you. One last is Valukasweda. Baluka means sand, Sweda means sedation therapy. Introduction, Valukasweda is done as a Ruksh Kriya. In other therapies we were using oil, but this is Ruksh Kriya, will not be using any oil. It can be done in whole body or locally on a specific part. It relieves pain and inflammation. What are the indications? Rheumatoid arthritis, muscular cramps, frozen shoulder. What are the requirements? Properly clean sand, around 2 kg. Equipments, a big frying pan for heating the sand, a spoon for stirring it, a tray. Heating apparatus, a stove or induction, cotton cloth, square cutting pieces 45 into 45 centimeters, and 4 cotton tabs to tie the potteries. Requirements for the procedure: table, 2 therapists, and vessel of round bottom. What are the purv karm, that is pre-procedure?
So inside it is sand, outside it is sand.
No, inside it's sand.
Outside to heat it, that's all sand.
We'll heat the sand first. We'll heat the sand. It will turn to red hot. Okay, then that sand remains heat till 20 to 25 minutes only. We don't need to reheat the sand, the pottery.
Okay.
And if there is requirement to in winter or in in that case, we'll take round vessel directly, heat the pottery in round vessel.
And 2 kgs the sand should be
2 kgs will divide 500 in 4 potteries. 4 potteries, 500 grams. Preparation of the medicine, preparation of the pottery, that is bolus, counseling and information to the client, monitor vitals including blood pressure and pulse. These are the pre-procedure. Now preparation of the Baluka pottery, how you make the boluses. Approximately 500 gram of clean sand is taken and heated and then shifted to middle of the cloth. The free corners of the cloth are approximated to cover the sand. The free ends of the cloth are folded in its middle and then tied with a cotton thread to make a round pack with handle. In this way, 4 potteries are prepared. We will prepare the potteries in the same way we were preparing ShashtikaPindaSweda and PatraPottali. Now heating the pottery. A round vessel is taken and is heated. The pottery prepared are placed over the vessel and continuously moved. When the pack is properly heated, it is taken out of the vessel and then applied.
So we will get the incidents where we have to reheat the pottery.
We can get, usually the procedure is 30 minutes to 45 minutes and the heat remains intact in sand till 30 minutes. If we need to heat the pottery, we will directly heat it over the pan. By continuously stirring it.
How can
Directly.
you stir the pottery? Oh, you need to move it.
Yeah.
The clothes will get wet.
No, it won't.
It's dry sand.
So the clothes will not get the heat.
No, the sand will also get it.
Okay, right.
Preparation of the patient. Depending on the comfort of the patient, Swedana is performed in sitting position or lying down position. Example: if knee joint is selected and can be performed in the, then the procedure can be performed in the supine position of the patient with the head rested upon the pillow, the hands placed on the sides of the body, and the knee is exposed. Pradhan Karam, what is the main procedure? The temperature of the pottery should be confirmed by the therapist by touching the pottery on the dorsum of the hand. Then pottery is applied on the patient's body for Swedana. The pottery is tapped softly on the affected side. We do not rub the pottery, this baluka. We do not rub the pottery with gentle. Once the heat is lost, it's warm, then we can do it. What are the precautions? Tie boluses firmly to avoid leaking of the contents during rubbing. The therapist in both the sides of the patient should massage with the bolus in a synchronized manner. Ensure uniformity of pressure and temperature on all the body parts. Boluses should be applied with sufficient warmth, that is 45 to 50 degrees Celsius. The therapy should be stopped at any time if the patient gets good perspiration. Therapists should be very cautious during the procedure, as this procedure may cause severe injuries or burns to the skin. What are the complications? Observe for burn, fatigue, etc. if present. In case of Ati Yog, that means excessive sweating.
अगर वो sweating करेगा तो that cause like potli will get wet.
We stop the procedure if we get good perspiration. अगर sweating होगी, we will not continue the procedure.
But about the normal perspiration, हल्की सी हुई तो.
That then we can continue. That perspiration is not as much to wet the potli.
Okay, so with the heat only, you just keep on getting the dry by itself.
Emergency management in case of burns, application of Sharda or grit to the burnt area should be done. Leaking potlys should be immediately replaced with the new ones. What are the do's and the don'ts? Do's: Ushna Jalpan, warm water intake. Ushna Vihar, traveling in warm climate or warm places. Ratri Swapna, that means early to bed. What are the don'ts? Sheet Jalasana, cold water bath. Sheet Vihar, traveling in cold places or cold climate exposure. Diva Swapna, day sleep.
We can do it in inflammation, joint pain and fractures.
No, not in fractures. It's contraindicated in fractures. Three of the therapies.
Inflammation and
Ma'am, how we will differentiate which totally we will use in osteoarthritis?
In osteoarthritis, we can use with the oil, like PatraPottali or ShashtikaPindaSweda.
Both.
Yes. But in rheumatoid arthritis, there is inflammation.
Yes.
So we avoid using oil or the therapies with the oil. So we can use Valukasweda, that means Valukasweda, sand potli.
If the inflammation is there, then we will use the sand potli.
Yes.
and we can use it in muscle pain as well.
Yes.
If we don't have sand, we can use sea salt as well, right? Because
We add salt in this.
In this,
We can add.
no, I'm just talking about only salt.
He's asking for alternate.
I don't. Salt has different properties.
Because in my home, they use this salt, right? Sand is not there.
There's different. Ishtik also used. That is brick powders also used. You can use sand also.
And what about osteoporosis? Can this procedure be
No,
used?
no, not in osteoporosis. It's usually in joint pains. So osteoporosis is a different process.
मैम ये डिफिकल्ट है कि इन्हें जस्टिफाई कैसे करेंगे कि कौन सी और ग्रेवेस ऑस्टियोआर्थराइटिस में भी इन्फ्लेमेशन होती है, रूमेटॉइड में भी होती है.
जब आपके पास पेशेंट आता है, the patient usually comes with investigations. We investigate for RA factor.
Yes.
If there is RA factor, if there is stiffness in the joints.
Yes.
In chronic patients, we do not have stiffness in the joints in RA.
Okay.
There we can use PatraPottali.
Okay.
Okay, but if the patient is coming with inflammation and stiffness of the joints and the patient is of RA, there we will use Valukasweda, that is Sweden. The Sweden where we are not using any oil.
And in muscular dystrophy,
In muscular dystrophy, ShashtikaPindaSweda, it provides strengthening of the body.
not PatraPottali.
No, that won't be helpful. We need to give nutrients to the body. It is helpful, but ShashtikaPindaSweda is preferred over PatraPottali. PatraPottali will pacify the pain. It will subside. The patient will get pain relief. But we also want to give nutrients in muscular dystrophy, strengthening to the body. So ShashtikaPindaSweda is preferred over.
we can do it on the spine if someone has back problem, back pain.
Right over the spine.
Yes.
Right over the spine.
No, not on the
Yeah.
It's the pain is in the area.
If the condition is infectious, that means the Port's disease, injury of the spine, you can't use it.
Not in
None of them.
infections.
Okay. In PatraPottali, any kind of patra leaves are.
Nirgundi Patra,
Only
Shiku Patra, Neem Patra, Ark Patra, the leaves of the plants which are having Vathar properties.
Okay, so neem goes with legs.
Neem patra.
Neem, Eran Patra also.
Neem is cool, right? Or same?
Neem, Patras are hot potentially.
Okay.
Patras are hot potentially.
Ma'am, is it necessary to take all the patras or whether we can take few like?
We can take few depending on the availability.
Any
We'll
specific
go with
size of the sand because you get different
We'll take
fine sand?
fine sand only, not very fine because it will leak through the cotton cloth, but we prefer fine sand because we'll exclude all the gravels or the like that. Not very.
So that sand can be reused, right?
Yes, sand
The
can
next
be
procedure,
used.
next. But the portly cloth has to be washed. Otherwise, वो same कितने patient को use कर रहे हैं?
How we use, we generally avoid using same potli on the different patients.
नहीं portly will wash it for sure.
Sand also, sand
कैसे
also.
wash करें?
No, not wash, but we avoid. We can use the same potli for the same patient for 7 to 10 days procedure.
Okay.
Say if a patient comes of rheumatoid arthritis, what should be the frequency of the treatment? How many times and for how long?
That depends upon the other medication the patient is taking, the chronicity of the disease, how long the patient has been suffering from RA. It will give pain relief. So 7 to 10 days should be enough, and we can repeat it after 1 month.
At a stretch, for how long it can be given?
Yes.
It can be given for how as much as long we
In the
want it.
inhalation.
7 to 10 days or more
Till
than
no 7 to 10 days with the gap of then 1 month.
Okay.
But if the severity is more than the continuously for
Then
how
we can use
we can prolong the
continuously,
treatment.
yes.
Yeah, na?
Can we use mechanical sand?
I don't know what is mechanical sand.
No, because now natural sand is
No.
banned. There is a ban generally.
No, only the
We have
Balu is sand only.
banned.
नहीं
Type of sand.
लाल तरह के नहीं होता है?
नहीं.
वो कौन से लाल? ग्रे कलर के जो मिलता है खाद पे ऐसे.
Grey one. We will heat it up to it turns to red or brownish.
What was the last one? Do's there was last one. I think last one. Do's and don'ts, right?
Yeah.
What was the last one? Can you just-
Go to sleep early.
Go to sleep early.
This we're asking.
Okay. What is it? Ratri.
Ratri means going early to bed.
Okay.
As I've told you, awakening late at night, it increases Vata in the body. And what is the, we can see the Vata cause for the pain.
Okay.
So day and night sleep, either Vata or Kapha.
Cup.
Cough.
Fifth, there is no problem.
हम दिन में सोते क्या होता है?
Cough or pit, but cough is dominant.
Thank you.